Pulmonary hypertension simply is just elevated pressures in the right side of the heart. The connection between blood clots and pulmonary hypertension is a very interesting connection because pulmonary embolisms or deep venous thrombosis or blood clots within the the vein part of the body, can lead to acute pulmonary hypertension if they are extensive. I mean, they're blocking flow, and that causes pressure to increase, leading to an acute pulmonary hypertension phase, leading to a kind of pressure on the right side of the heart. But over time, even when blood clots resolve, a certain percent of those patients can actually develop chronic pulmonary hypertension. So it's very important if you've had a blood clot to maintain follow-up to make sure that doesn't develop, because if it does, we do have treatments for it. And that disease phenomenon is known as chronic thromboembolic pulmonary hypertension, or CTEPH. So the symptoms caused by pulmonary hypertension, if you think about what it's affecting, then we can talk about the symptoms. So it's affecting the lungs, it's affecting the pressure within the lungs, and it's affecting oxygen exchange, right? So that oxygen exchange, when it's affected, most times patients complain of breathlessness or difficulty with breathing with even minimal exertion. Sometimes patients, especially if it's clot oriented, they can experience fainting spells where they're standing up from a seated position and they start to feel like, hey, I've kind of lost my balance, like everything is a little bit more, like I feel breathless and I can't catch my breath. Also, sometimes patients will have, coughing up blood. They will have, muscle aches and general fatigue. It's always important to talk to your doctor to make sure that you don't have anything more nefarious going on, because sometimes these symptoms could also be due to mild diseases. Let's say, you get diagnosed with pulmonary hypertension. What changes can you make in your day-to-day life that can improve, your symptoms and your, quality of life? I tell my patients all the time, it's important for you to incorporate exercise as much as you can to improve the oxygen exchange in the muscles. We, in the pulmonary world, like to focus on strength training. Also, we want to limit the amount of unnecessary salt. Salt is important for the diet, but we don't want to increase it too much over the ADA recommendations, because salt and water can cause fluid retention, which is not a good thing when you have pulmonary hypertension or even sometimes essential hypertension. And making sure that you get an adequate amount of calories but not too many, and that they match your output throughout the day.